Well, look, a campaign group representing families who lost relatives to COVID have now accused the authors of this report into the handling of the pandemic of gaslighting bereaved families.
Yes, the damning report has found serious errors and delays made by the government, which ended up costing tens of thousands of lives. But the group Bereaved Families for Justice say the report is a slap in the face. Well, let's speak now to the chair of the National Care Association, Nadra Ahmed, because, of course, care homes feature in this report, and Deborah Doyle, who is a member of Bereaved Families for Justice UK. Deborah, you lost your mum to suspected COVID-19 whilst she was in a care home last April, and we're so sorry for your loss. I mean, when you read through this report, what does it make you feel?
Unsurprised, to be honest, Susanna, because like Richard's just said there, that, you know, we were aware of this with our lived experiences of members of the group. So it comes as no surprise to me, but it makes me really angry and upset that this happened. It's quite unfathomable, especially when the government were claiming that there was a protective ring around care homes, which obviously with this report there clearly wasn't.
There's the use of the word gaslighting, and I think you must feel that more keenly than anyone, because this catastrophic mistake of letting hospitals discharge patients to go into care homes without sufficient testing. I mean, the government's got an explanation for that, but it doesn't wash, does it?
Well, the thing is, Susanna, when a relative or a loved one goes into a care home, you know, you're only understanding that's a really safe place for them to be in.
Yes.
So for them to send infected patients into a care home makes them sitting ducks. And also the staff are under enormous pressure with people who are frightened, breathless. You know, I mean, 12 people died in my mum's care home. There were 48 residents in there when it was at full capacity. That's an enormous number of people to die unnecessarily. And that's, you know, on top of the people that would have died of natural causes as well at that time.
We'll come back to you a little bit later after we've spoken to Jeremy Hunt. Let's now go to the chair of the National Care Association, Nadra Ahmed. Good morning, Nadra. Thanks for joining us. I want to read you a message that we've had from somebody called Phil on email. He says, I'm an NHS senior manager. Please don't use hindsight to apportion blame, because hospitals at that time genuinely felt that nursing homes would be safer with individual rooms rather than open wards. Knowledge was very poor at the time and everyone was unclear, but they did their best to prepare for the worst. What's your view on that kind of view, Nadra?
Well, I think partially what he's saying is correct in that the information that we were being given was that there was nothing to worry about in a care setting, and it would be okay. It was the hospital. I mean, the mantra was to protect the NHS, and in order to do so, it was to get vulnerable people out of those hospitals into care homes, where they told us that the likelihood of the virus coming in or spreading was very low, despite the fact that this report points out that they were the highest risk.
So why do you think that catastrophic error of judgment was made? Was it simply based on, if you like, the triumph of optimism and hope over a lack of information?
I think it was a lack of planning. There was no plan for what might happen to vulnerable people in care homes. There was a plan to keep the NHS safe. There was a plan to make sure that we had the capacity to deal with what we were seeing was happening in Europe. So there was this massive move to not have that happen in England. And the way to do that was to empty out the wards. Yeah. What was severely lacking and missing was any thought around how we would protect the people in care homes who were the most vulnerable. It was a lack of planning, it was a lack of insight, a lack of understanding, and a lack of years and years of not understanding what social care does and how it can support the NHS, completely thinking we would be okay. And the PPE issue, you know, by diverting all PPE away from social care into the NHS, that was massive.
Okay.
When we could...
Yeah, Nadra, the only reason I interrupt is because actually we have the former Health Secretary standing by to answer exactly those points that you're making so powerfully. Jeremy Hunt, who was, of course, himself Health Secretary between 2012 and 2018. He's the chair of the Health and Social Care Committee, and it's your committee that has published this report alongside the House of Commons Science and Technology Committee. I mean, it is devastating, Jeremy Hunt, that basically decisions on lockdown, social distancing during the early weeks, the advice that led to them, rank as one of the most important public health failures the UK has ever experienced. What did we do wrong with particularly this issue of care homes? Matt Hancock told us that they'd put a protective ring around them. They hadn't. The government did not put a protective ring around care homes because too many people were being discharged from hospitals into care homes, and we saw the catastrophic effects on families like Deborah's. What went wrong?
Well, it was exactly what Deborah and Nadra are saying, which was that when we had this crisis, people were looking at TV screens, seeing what was happening in Lombardy, and the centre of attention, the focus of attention, as so often happened in my time as well when I was health secretary, became what was happening in hospital wards. And we didn't have that bigger picture as to the whole system. And that's what we urgently need to put right, which is why our recommendation, our strong recommendation, not the first time we made this recommendation as a select committee, is that we need a 10-year plan for the social care sector, a big increase in funding for the social care sector, just as we had for the NHS going back to 2018.
Do you think that part of the reason for the mistake in terms of sending patients back to care homes from hospitals, to be fair, was that there was a high degree of ignorance about how the virus actually functioned? I mean, I remember in the early days of the pandemic, we were told to wash our hands constantly. We now know that actually the chance of picking up the virus through contact is quite low. We breathe it in. Would you say that this catastrophic error in terms of care homes was based obviously partly on optimism, but also on ignorance about how the virus actually transmitted?
Well, of course, Richard, when it's a new virus, there are lots of things you don't know. And indeed, we can only write this report with the benefit of hindsight. We should say that up front, but it's really important we do learn those lessons. And in that context where there were things that we didn't know, it took us too long to get to the right approach. And that's why we say in this report that one of the things we should do is SAGE should publish its advice to ministers within 24 hours in a pandemic so that it can be scrutinised by other scientists up and down the country, so that we can ask questions about whether, for example, we should be looking at the way they're approaching things in Korea or Taiwan. But I think it's also important to say that the report is balanced, and we say this was like a football match with two very different halves. And yes, there were those very serious errors that Deborah talked about, led to many tragedies. But in the second half of the match, we had the vaccine programme, which was, we say, the most effective initiative in the history of British science and public administration. We had the discovery of treatments like dexamethasone in the UK, which saved 1 million lives worldwide. We had that extraordinary response from the NHS, which saw that everyone who needed a ventilator and an intensive care bed got one. So it's really difficult to sum up in one sentence or one phrase what our national response was, because we had these very, very different and contrasting aspects.
But the thing is, Mr. Hunt, I totally agree that, you know, we managed to do some things absolutely brilliantly. That just doesn't wash with those who lost a loved one early on in the pandemic. And in the report, you say earlier social distancing and early locking down would have bought much needed time. We made the mistake of not being over-prepared. If we'd gone earlier, faster, harder, as we heard Dr. Pankania saying earlier on the programme, and as we reported every single day early on in the pandemic, thousands of lives could have been saved, and thousands of people wouldn't now be suffering with either losing a loved one or with the effects of long COVID. We just didn't go early enough. And the criticism is at the door of the Prime Minister, because he was seen as being too cavalier and he's too much of a populist. He didn't want to do something that was unpopular. As your report says, actually, these things turned out not to be unpopular. We were remarkably complicit and have been all along. We didn't do it quickly enough, did we?
Well, that's what we conclude in the report, that we should have gone earlier. But we try to understand why. And, you know, the Prime Minister is, of course, ultimately responsible. but some of the advice that he got was also wrong. And there was a groupthink that the way you tackle a pandemic should be similar to a flu pandemic. I was part of that groupthink too when I was health secretary. In fact, during that period, an American university said we were the second best prepared country in the world. We know that clearly wasn't the case, because that groupthink extended right the way across Europe and North America. And the countries that had direct experience of SARS and MERS were the ones who responded best in the first half of the pandemic. They're actually having more problems now. And I think the lesson from this is that we need to take as seriously diseases that happen the other side of the world as we do the diseases that we've had direct experience of ourselves. We need to open up SAGE, make sure that we are quicker at understanding and following international best practice. And we need more resilience in the system. I mean, that was, I think, the point that we're hearing about the social care system. It's been struggling for very many years. I tried to get extra money from it, wasn't successful, but then with my colleagues in the select committee carried on campaigning for that, and we have had a bit of a breakthrough, I think, in the last month.
All right.
But much more to do.
Just to pick you up on this point about groupthink, which I think is a point well made, but it does kind of slide around the personality of the Prime Minister. I'd like to sort of follow on from what Susanna said. I mean, Prime Minister's part of the job is to carry the can home, isn't it? And there is no doubt that our Prime Minister has a very strong personality. It's very dominant, and he dominates his cabinet. And one does have to wonder if his implacable resistance to the use of face masks originally, he was dead against it, his implacable resistance to lockdown on principle infected cabinet decisions. And that was the strength of his personality. And on those two issues, and I take the hindsight point, but on those two issues, he was just wrong. How much of his personality and his will is at the root of the mistakes that were made early on?
Well, obviously, every Prime Minister's personality matters, but in this particular case, on those particular decisions, he was following the scientific advice. And the question we have to ask is why across the whole of the system in those early months, everyone was advising the wrong approach. People like Professor Neil Ferguson say if we'd locked down only a week earlier, thousands of lives would have been saved. But I think the paradox here is that those same people who got that decision on the lockdown timing wrong were the very same people who pre-ordered 400 million doses of vaccine that we had no idea at all whether they were going to work or not, and gave us the best vaccine program in the world. And so that, I think, is one of the reasons it's very difficult to sum up very succinctly our national response, because we have those two very different sides.
All right, should we go back to Deborah Doyle? Deborah, as we said a few minutes ago, you lost your lovely mother, Sylvia, and nothing can bring her back. Listening to what Mr Hunt's just said, do you take any, not comfort from his words, but is your anger a little less, having heard his explanation and him placing things into what he sees as the context of what happened?
Well, can I just say, using the comparison of the football match, which Mr Hunt has just mentioned there, if footballers will practice and they will look at other teams. So we had the Cygnus exercise in 2016, which should have given preparedness for this pandemic. And also it was happening elsewhere in the world. So, as I say, no, it doesn't give me comfort, because are we learning lessons? I don't think so. The vaccine rollout has been a great success. I will agree with that. But then the general public are kind of being complacent, i.e. not wearing masks in closed spaces. And I'm really fearful for the winter. And I'm really fearful that this will happen again and we will lose more lives. I mean, we're losing on average around 1,000 people a week still. And as Susanna said, long COVID is another issue, another health issue for this country. It's really concerning. Mr
Hunt, will it happen again?
Well, I think we have learned a lot of really important lessons, but, I actually totally agree with Deborah. We just cannot be complacent, and we've got the added risk of flu coming up this winter as well. We are not out of the woods yet.
Well, thank you all very much indeed for your time. This is obviously going to dominate the news agenda for the rest of the day, probably for the rest of the week. Thanks for all the comments.